Bismillahirrahmanirrahim. Hi, I am Rafid Mustafa. Today we will discuss type 3 hypersensitivity. Previously, I have discussed type 1 and type 2 hypersensitivity. Today, I'll discuss about type 3 hypersensitive reaction. So, let's get started. Now, there is a synonym of type 3 hypersensitivity. It is also called as immune complex hypersensitivity. Please remember this name, immune complex hypersensitivity. Here, in type 3 hypersensitivity, the antigens are free and antibody are also free. But in type 2 and type 1 and type 2, I have discussed how is the state of the antigen and antibody. Now the mechanism of type 3 hypersensitivity. Previously, during the synonym, I have told that remember the name immune complex, and this will help in this understanding the mechanism. First, here we can see that there is an antigen, and then there is also an antibody. The antigen get into our body by any way, and when they enter into our body, autoimmune person develop IgG antibody against those antigen, and this antigen antibody bind together, and they form antigen antibody complex, and this may deposited in the blood or any organ like spleen, liver, and also joint. And when they get deposited, and they activate complement, and how they activate complement I have discussed broadly in the previous lecture of type 2 hypersensitivity, and I will give the description. Please watch it there. And during the activation of complement, it produces C3 and C5a. The C3a and C5a attracts neutrophil, and when the neutrophil comes to the site of the deposition of the antigen antibody complex, this neutrophil releases various substances and enzymes. This causes damage to the endothelium of the blood vessels. And due to the damage of the endothelium, blood products and plasma all leaks out from the blood vessels, and it may cause various presentation outside of the blood vessels. And this may also occur in same type of mechanism can also occur in if they deposit in joint, or it may cause joint pain like symptoms, or it may deposit in spleen and may cause splenomegaly, etc. Now, the type 3 hypersensitivity may be classified into two types. One is the Arthur's reaction, and other one is the serum sickness. First, the Arthur's reaction. Here, the Arthur's reaction, it is named by Dr. Arthurs. And here the thing is that the inflammation will occur at localized site. Remember, in Arthur's reaction, there will be localized inflammation. And there are various examples of type 2, of Arthur's reaction, mainly the farmer's lung, which is caused by inhalation of thermophilic actinomycetes. And now there is also other examples like cheese worker's lung, wood worker's lung, and wheat miller's lung. And these all are due to inhalation of the or microorganism, either bacteria or fungus, or it may cause due to inhalation of foreign particles. Now the mechanism, it is the same. I have told it previously, but I am going a thorough review. Here the antigen antibody will bind together, and this will form antigen antibody complex, and this will get deposited in the blood vessel, and this will activate complement and this will form the activate complement pathway and form C3 and C5a. The C3 and C5a activate neutrophil and releases various substances and causes damage to the localized site. Now, if we see a picture of Arthur's reaction, it is just like this. It is a slight localized erythema, nothing more than that. Here the symptoms will be localized. Now the serum sickness. In contrast to Arthur's reaction, serum sickness will be generalized inflammation. Here it will systemic inflammatory response. But in Arthur's reaction, there is localized inflammation. But in serum sickness, there will be systemic inflammatory response. That means throughout the body, it may cause symptom. And that means that the immune complex may deposit throughout the body. And how it happens, if we inject a foreign serum, suppose we normally there are various substances that we can produce from animal horse, and also some drugs. And in these cases, the antigens are excreted very much slowly, and due to the slowly excretion of antigen, antibody get time to develop, and this antigen antibody binds and deposited in various sites of our body and causes symptoms. And what are the typical symptoms like fever, urticaria, arthalgia, lymphadenopathy, splenomegaly, and eosinophilia? And the symptoms usually improve after a few days as the immune reticular endothelial system removes those antigen antibody complex. This is a typical feature of serum sickness, how it manifests. We can see that all over the body there are erythema, and there are sometimes some side at some place there are some patches, etc. There are typical examples of type 2 hypersensitivity. First one is the glomerulonephritis. Second one is rheumatoid arthritis. Third one is SLE and vasculitis. If I go through each of this point, first the glomerulonephritis. In glomerulonephritis, the thing happens that we know that group B streptococcus has two strains. One is the nephrogenic strains, and another one is rheumatogenic strains. The rheumatogenic strain causes rheumatoid fever, and the nephrogenic strain causes glomerulonephritis. It is commonly known as post-streptococcal glomerulonephritis or PSGN. Here, in glomerulonephritis, the thing happens that the nephrogenic strain of group B streptococcus attacks the skin of human body. It attacks the skin of human body, then the antigen and antibody togetherly binds and deposit at the basement membrane of kidney. Here, it appears like, and at that site, it activates complement and causes, and it attracts neutrophil, and neutrophil then damage the basement membrane. If we see in electron microscope how it appears lumpy appearance. Just like this, over the basement membrane, there is appearance of lumpy appearance on the glomerular basement membrane in glomerulonephritis of PSGN. Next one is the rheumatoid arthritis. In rheumatoid arthritis, we have to remember a term called rheumatoid factor, or shortly known as RF. Sorry for the delay. It also calls rheumatoid factor. Rheumatoid factor means the antibody. It belongs to two type of antibody. One is the IgG, and another one is IgM. So what I have told, rheumatoid factor belongs to antibody. One is IgG plus antibody, another is IgM antibody. This IgG or IgM antibody attacks the normal human immunoglobulin G antibody. It attacks normal human immunoglobulin G. And due to this attack of normal human immunoglobulin G, this rheumatoid factor and immunoglobulin, these two complexes deposited at the joints and causes pain at the joint site. This is the typical pathology of rheumatoid arthritis, and it is very much important for the exam. Now the SLE. In SLE, the thing happens that the antigen are human DNA. Human DNA act as an antigen, or human nucleus can also act as an antigen. So it is the DNA, suppose it's the DNA or the nucleus. This both can be the antigen. And the antibody attacks the human DNA or nucleus. And this causes lysis of the cell. That means cell death. And the cell product comes out. And the typical features of SLE like butterfly rash over the face or alopecia, oral ulcer, the thing occurs due to this mechanism. And the last one is the vasculitis. Vasculitis is nothing but that the antigen antibody deposit will get deposited on the blood vessel. Here it will deposit on the blood vessel, like here it will deposit, and this will cause typical feature. And this will here there will be it will cause attraction of the neutrophil and damage of the endothelium, and typical features will develop. Some of the examples of vasculitis are polyarteritis nodosa, giant cell arteritis, temporal arteritis, etc. Thank you. If you have learned something, please like the video and subscribe the channel. Assalamu alaikum.